All right, one big hot topic these days is whether someone is an independent contractor or not. As many of you know, there's a lot of noise out there, a lot of news articles about this topic because Uber and Lyft and Postmates and all of these gig economy type companies are fighting their states and fighting, other organizations regarding, the laws that are being passed regarding independent contractor status or not. Here's what's important for you to know with regard to your practice. For the most part, 9 out of 10 times, anybody that you hire in your practice will not qualify as an independent contractor. And the reason they will not qualify as an independent contractor is because, quite frankly, they do not meet the requirements, whether set by the IRS or the states. And the reason they don't is because of what I like to term control, which is how much control do you have over that person? Do you tell them when to come to work? Do you give them patience? Do you tell them, what tools they can use? Which employees will work with them? Do you tell them when to take lunch? All those things are things around control that make a huge difference when it comes to independent contractor versus employee status. And so to be safe, if you're risk averse and you don't want to take any chances with the IRS or the state, putting everyone, including your doctor associates, as employees is the right thing to do. If you are willing to take the risk of an audit potentially, then you can choose to put them as an independent contractor. But remember that as a business owner, as the employer, there's much more risk on you than there is the employee because you have much more liability than they do with that misclassification. Okay, very, very important thing to know. Now, some of you may ask, well, what's really the benefit tax-wise? Well, most CPAs that we talk to tell us that it's anywhere from 7-8% on the low end to 10-12% on the top end difference between the two. In other words, by putting someone as an employee, you might be spending anywhere from 8 to, let's say, 12% more than if you had them as an independent contractor. Now, that can definitely add up and it can definitely be a significant sum of money, but usually it's not a game changer. In other words, it usually is not going to make or break your practice by paying someone that much more because of taxes and things of that nature that now you would have to pay. So keep that in mind, but of course it's a case-by-case situation. Some of you have health insurance that you pay for your employees, and so you would have to pay that for doctor associates as well if they're employees. If you have 401k plans and things of that nature, I know they're more rare these days, but if you have those, you may also have to pay your employee for those, which is why the number also can be higher than or on the higher end of that range that I was mentioning. So if you have any questions about it, let me know. I'm happy to walk you through it. Thanks.